I'm Declan Barry, and I'm proud to serve as Director of Research at APT. On this 50th year celebration of APT's founding, it is fitting that we reflect on some of the many research highlights that have marked its first 50 years. In 1970, Dr. Herb Kleber, a faculty member in the psychiatry department at Yale School of Medicine, founded the Addiction Prevention and Treatment Foundation, which later became known as the APT Foundation. Dr. Kleber is now recognized as a pioneering researcher in addiction medicine. His early mentees included Drs. Tom Costin, Bruce Ranseville, and Richard Schottenfeld. Together, they conducted groundbreaking research at APT that elucidated the medical and psychiatric comorbidities of substance use disorders, and they evaluated innovative treatment approaches for a variety of substance use disorders, which often combine pharmacotherapy and psychotherapy. This illustrious trio went on to mentor other APT-affiliated researchers who have had a lasting impact on the field, including Drs. Kelly Evans, Sam Ball, Kathy Carroll, David Filene, Joel Galertner, Sonia Luther, Art Margolin, Alison Oliveto, Patrick O'Connor, Mark Patenzo, Elise Triffelman, and others. Currently, APT is a research home to a cadre of well-known addiction researchers with expertise in internal medicine. For example, Drs. Kenny Morford, Julia Shee, and Jeanette Tetro. Neuroimaging, for example, Drs. Kathleen Garrison, Helena Rutherford, Dustin Shinost, and Sarah Yip. Infectious disease, for example, Drs. Rick Altis, Mike Copenhaver, Jamie Meyer, and Sandra Springer. Pain management, for example, Drs. Declan Barry, Mark Beitel, Christopher Cutter. Parenting, for example, Drs. Tom McMahon and Nancy Suckman. Sleep medicine, for example, Drs. Nancy Rediker and Clara Yagi. And public health, for example, Drs. Robert Heimer and Lynn Madden. In addition to conducting randomized clinical trials on treatment efficacy and effectiveness, these researchers are conducting novel studies to facilitate the training of providers on evidence-based practices. As we see in this clip, in the last 50 years, APT has honored the legacy of its founder, Dr. Herb Kleber, by being the location of innovative and cutting-edge research funded by the National Institutes of Health and other agencies, and being on the forefront of applying research to clinical practice to benefit our patients and the community. Tetra have conducted research on the clinical needs of their patients and on the services provided to them at the Central Medical Unit. I direct the APT pain treatment services and oversee a research team that includes Drs. Mark Beitel and Christopher Cutter. Our team has elucidated the treatment needs of APT patients with chronic pain, as well as the challenges faced by their providers. We have developed and tested novel group treatments as part of APT's regular group scheduling. And we have trained APT's addiction counselors on brief, non-pharmacologic approaches to manage chronic pain. I also oversee APT's qualitative research team. We have published findings from interviews of addiction counselors at APT about their experiences treating patients, as well as implementing the open access model. We are now interviewing APT nurses about their experiences. Also, we are coding transcripts from interviews with APT patients who have criminal justice involvement with the aim of better understanding their experiences and clinical needs. One measure of the importance attached to research at APT can be gauged by the fact that 3 directors of our outpatient clinics are currently pursuing doctoral degrees: Kim Diniola, Kathy Eggert, and Scott Farnham. Since we have assembled a trove of in-house clinical data, our new cohort of addiction medicine fellows, Drs. Carolyn Chan, Sean Cohen, and Ryan Wade, and addiction psychiatry fellows, Dr. Olu Jijed and Siva Kalyamurthy, are examining some of these data under the mentorship of APT researchers. We are grateful to our team of APT research assistants, including J.C. Bissell, Lauren Holloway, and Gazwa Najada, as well as the APT Information Technology Department under the leadership of Ihab Hussein. All have been instrumental in supporting APT-generated research. If you would like to know more about research at APT, please take a look at the APT webpage. Thank you for your time and enjoy the rest of the gala.